Hello everyone, I am Dr. Namita from Nivaran Hospital. Today I am here to discuss about the topic irregular periods. Irregular periods patient आता है बोलता है मैम periods में गड़बड़ हो गई है. That is irregular period. क्या होता है irregular periods? नॉर्मल हमारी 28 डेज की नॉर्मल पीरियोडिक साइकिल्स होती है जिसमें हमें पीरियड्स आते हैं आफ्टर 28 डेज. बट इफ देर इज़ अ वेरिएशन लाइक इफ द पीरियड्स आर कमिंग बिफोर 21 days or after 35 days, missing periods for 3 or more times, heavy menstruation or scanty menstruation. This is called irregular periods. What are the types of irregular menstruation? Number one, it is amenorrhea, complete absence of periods. Patient को periods आते ही नहीं हैं. Oligomenorrhea, when periods are coming after 35 days and irregular. Then there is hypomenorrhea. Periods तो आ रहे हैं but बहुत ही कम, scanty periods. Menorrhagia, when there is an excessive flow of blood during menstruation. Then this is intermenstrual bleeding, when periods are coming in between 28 days, मतलब after 15 days, after 20 days, patient is complaining कि बार बार periods आ रहे हैं. Then there is post menopausal bleeding, मतलब periods खत्म तो हो गए हैं, साल भर से patient is not having any period, then suddenly patient starts having periods. Then post coital bleeding, कि after having intercourse patient is complaining of bleeding. First, we'll discuss about the causes. What are the causes? What can lead to this irregular periods? Number one is puberty menorrhagia. Puberty menorrhagia is when the female is starting off with the periods for the first time. And usually the children of 12 to it starts after 12 years of age, and during this course of 1 year, basically 1 year, the puberty menorrhagia continues. Kid is having irregular menstruation. That doesn't require any treatment. But if it is in excess, then you need to consult with the gynae. Then second thing is heavy menstrual bleeding. Patient is having heavy menstruation that can lead to anemia. Okay, anemia, weight loss, anorexia. Then patient is having this postcoital bleeding, which can cause, there may be some underlying cause, there may be subuterine fibroid, there may be some polyp. Then after menopause, postmenopausal bleeding. Postmenopausal is a kind of bleeding which you should not ignore at all, because that can lead to cervical cancers or some serious underlying pathology that you need not be skipping. Now, what is the treatment for irregular periods? Like as I told you, puberty menorrhagia and menopausal. That time, if you are having menstrual irregularities and the underlying pathology has been ruled out, then this doesn't require any treatment. It usually settles down on its own. Second is OCPs, birth control pills. If the patient is having variation in bleeding, OCPs contain estrogen, progesterone that can help to regulate the menstruation. Third is PCOD. If the patient is having PCOD, then weight reduction is one of the effective way to control, to regularize your period, because decreased weight leads to decreased production of insulin. When there is decreased production of insulin, that lead to lower testosterone level and better ovulation. Then thyroid. If the patient is having hypo or hyperthyroid, if that is corrected, that also helps in regulating the menstruation. Stress, anxiety, and overeating, these should be reduced. That will automatically help in reduction of your periods. And last, fibroids. If you are having fibroids and that is causing you excess bleeding, pain, then you should definitely consult your doctor. Either myomectomy or your hysterectomy can be done. That will help you to ease off with your problem. So these are the few things we should keep in mind, and definitely maintain a menstrual calendar for 3 months. And if you are finding any discrepancy in these 3 months, excessive bleeding, passing of large clots, abnormal than the usual, then you should definitely consult.